Hi, good morning. My name is Shannon McCarthy. I live in Dalton, Massachusetts. It's a small town in Western Mass. It's also commonly referred to as the Berkshires. You may have heard of that. We are located in the Eastern Time Zone, and the pronouns that I prefer are her, she. Most people call me Shannon or Shan. Um, my nephews, even though they're almost teenagers now, still call me Shanny, which I think is cute. Anyhow, my practicum for my bachelor's program was in a medical center, an intensive psychiatric care unit. I was allowed great experience working directly with clients and did conduct some group therapy there as well. However, the patients were so impaired, I didn't feel like I was making much of a difference, and it really did open my eyes that this was not the setting that I wished to work after graduation. Like as I said, the level of impairment was great, and to be completely honest, I was uncomfortable as there was a great deal of violence from some of the patients, and there was a lot of medication interventions that needed to be provided for people that did escalate to that level. I had seen people being restrained, and it just left me very uncomfortable to see other people in such a situation. One piece of the position that I really did enjoy was advocating for the clients to ensure the post discharge transition to the next level of care. I was able to advocate and really felt like I was making a difference in that area. Another thing was there is the intensive care psychiatric unit, and there's a step down unit there as well. They're called Jones 2 and Jones 3. And it was really impressive to see clients come in, like I said, with this level of impairment and actually discharge after having some clinical intervention, medication, psychopharmacological intervention, and just to see the level of functioning increase and really brief lengths of stays. I mean, sometimes, 10 days, 10 to 14 days, it wasn't a real long length of stay. So I am really grateful for the time that I spent in this setting. I think it will help me with patients that are dually diagnosed, which is really an interest of mine, working with clients with a substance abuse disorder. I started my career out actually after high school for a period of time working as a secretary on a substance use disorder unit. 20 years ago, it wasn't called that. It was called the addiction unit. But I really did enjoy my time there and started out as well in that setting, kind of being intimidated by the patients. But the longer that I was there, it really is a interest of mine, and that's where I'm going to do my clinical or my current year practicum. It'll be on the inpatient detox, which is as well as the step down unit for clinical stabilization. So it'll cover the medical piece of detox as well as the therapeutic counseling piece. I'm really hoping to learn more about people with a substance use disorder, different treatment modalities, way to advocate for services, group facilitation. And the one piece that I'm really the most interested in is the one-on-one counseling. I've worked with my supervisor already this week and have sat in several of her educational groups, psychoeducational groups that she presents, and I really feel like I'm going to learn a lot from her. The way that she conducted the group was really impressive. So I think that some of the areas that I say a weakness or areas that I struggle. I did enter my bachelor's program really unprepared for some of the cultural competencies that we learned. I feel like the bachelor's program has helped me look at things from a more global lens and not just how I personally feel about things, but systematic, prejudice and just being more competent. I was really naive, and I feel like this is an area that I've grown. I still feel I struggle a bit with different theories and how to apply them to specific cases. I am taking my LSW exam actually this Saturday. No pressure there. And this was an area that it did identify that I needed to focus. So hoping that we touch on some things like that throughout this class. As I said, I am kind of going back and reviewing and teaching myself or filling in the gaps in my knowledge is what I'm actually doing now. I think the test is actually helping me with that. So personal interest, I love spending time with my 9-year-old daughter. This summer we actually bought kayaks and have really enjoyed spending time with her and connecting with nature, which is something I never really take the time to, take a time out for myself. I have been married for close to 15 years, remarkably to the same person. You'll see as we get to know each other better through this, I'm someone that really tries to find the humor in everything and not take things too seriously, which can also annoy that person I was just talking about being married to for close to 15 years. Anyhow, we do have a small dog. Her name is Coda, and right now she is serving as a role as my daughter's first sister. My daughter is really looking for a sibling, and we're talking about doing some fostering and possibly adopting a child within the next couple of months. I'm excited about that. I'm also the administrative director for the medical center, the behavioral health unit. So my job is really demanding. I work a lot, trying to find balance between home and work is important. However, I'm the type of person that really thrives on being busy and learning as much as I can, and I'm really looking forward to getting to know all of you, and I'm excited to start this journey. So, thank you. Have a good day.